Hello, my name is Dr. James Stoxen, and I'm here in Dubai lecturing at the second case report conference as a keynote speaker. And the topic of my lecture was on Thoracic Outlet Syndrome. I talked about a case where a lady got into a very bad car accident and she had Thoracic Outlet Syndrome. And she was actually a nurse, and she was first misdiagnosed for almost a year and a half. And then finally, she suggested to the doctor that she had Thoracic Outlet Syndrome. After that, he did Adson's test, which is a test to determine if you have good blood flow in your artery in your arm by testing the blood pulse in various different positions with your shoulder, and he agreed with her that she had Thoracic Outlet Syndrome. After that, they did a series of treatments that actually did not help her, and then actually the treatments, they kept increasing in risk, and it made her worse until finally she gave up and she called us and made an appointment to get treated, and we helped her. If you'd like to watch that video, you can watch it on our page, and it's clearly outlined, and it's actually a video of the lecture that I gave at the conference. So you'll be able to hear the whole thing. Now, today I'd like to introduce you to my new book. This is a book that I wrote. It's the human spring approach to the treatment of Thoracic Outlet Syndrome. It's for doctors and patients. Now, you might say, well, what is the human spring approach to Thoracic Outlet Syndrome? And what I found out after suffering for 7 years with Thoracic Outlet Syndrome as a doctor, and I was in a chiropractic college, and my father was a chiropractor, and I went to everyone. I found out that the treatments that were provided were treatments that worked on lever systems like your elbow or your knee or your hip, but they do not work on things like Thoracic Outlet Syndrome or herniated discs. That is because these areas are designed or engineered as spring mechanisms. So you are treating a spring mechanism with a treatment that's mainly for lever systems or lever mechanisms. So when the spring mechanism locks up and does not allow the safe passage of blood vessels and nerves, like between the disc or in the thoracic outlet or tunnel, then you're going to end up with a condition that is a compressive disorder that may not, or usually does not, respond to lever mechanism type treatments. So I developed this integrated spring mass model, which was an advancement of a Harvard University model called the spring mass model, that was presented in 1989 or 90, and I expanded that model, and I outline the exact anatomy of the thoracic outlet area, the tunnel, and the supportive mechanism in chapter 1. And then I outline for you in chapter 2 and 3 the different models of movement that have been proposed, like the inverted pendulum model, the spring mass model, lever mechanism, or the kinematic chain kind of model, and then the spring mass model. So in my book, I actually discuss what treatments work only on lever systems and then what treatments work on springs. And so there's a chapter that says what doesn't work and why, and then there's the chapter 13 that talks about what does work. And in the book, I actually have very beautiful illustrations of the thoracic outlet and the muscles, and I actually have hired and photographed a model, and that we have her doing the self-help treatments, like in this case the subclavius muscle, and in this case the pectoralis minor muscle and the coracobrachialis muscle. So you can just put the book flat down on the ground and just, look at the anatomy, and then look at the photographs of the girl performing the self-help treatments, and you could treat yourself. Also in the book, if you are tired and it becomes more difficult for you, I actually have a section of the book that you can take with you to see your doctor or your therapist that shows me actually treating a patient with this method. And also we outline some of the therapies that I use, like the vibrating massage, and how to access these muscles, like the pectoralis minor muscle, which is actually underneath the pectoralis major muscle, like your pecs and your shoulder, and the best way to get at those muscles. So that's why this book will actually provide you with an outline of, what are lever mechanisms, what is the difference between a lever, like your elbow or your knee, and what is the difference between that and discs, which are compression springs, and the thoracic outlet area, which is built on a spring suspension system, and how it works. Simple, not difficult to understand. And then what treatments are worked with lever mechanisms like your knee or your elbow, and why they don't work on the spring mechanism, and how we can use very specific treatments that are outlined in the book to actually unload the tension from the muscles that are compressing the thoracic outlet area, and the muscles that are pulling and straining your body into a chronic state of suffering. So when you read through the book, it'll explain to you why you hurt here, which is a strain of the scalene muscles lifting the first rib, why you hurt between the shoulder blades, which is a tension from the pectoralis minor muscle that pulls on ribs number 3, 4, and 5 between your shoulder blades, and why some of those treatments don't work on you, that just adjustments alone without the muscle work, and how you can actually do self-help manual treatments, pressure points, and also what stretches work and what stretches don't work and actually make you worse. Like this stretch here will lift the rib up even higher into the thoracic tunnel and make you worse. So the book goes into what works, what doesn't, photographs of a model performing the self-help treatments, and also photographs of me doing the treatments on the model. So you can bring the book to your doctor or your therapist or your chiropractor, and you can say, hey, could you take a look at this, and maybe you can use these treatment methods on me. And also some therapies that I use that I think work and why. And then you'll be able to get the best treatment possible to unload the compression on your spring mechanism, i.e. your thoracic outlet that is designed as a spring suspension system. So in that case, please, if you buy the book and you read it, please review the book for me on Amazon, give me your best opinion, and then also feel free to email me or contact me if you have any questions, if you're confused or frustrated, and let me know what's going on. Let me know if I can help you in any way, and I'll do anything I can. Once again, here's the book. The book is Human Spring Approach to Thoracic Outlet Syndrome for doctors and patients. You can get it on Amazon in 13 different countries. If you want to know more about thoracic outlet syndrome, read some articles, some latest articles, go to thoracicoutletsyndrome.com. That's our blog, which has the latest scientific information, some reviews of articles, and that once again, this is a review of the chapters on what works and what doesn't, and I hope you enjoy the book. If you need any help, please contact me. Thank you very much.